Um, Next, I'm going to introduce Tom Johnson. So Tom joins the Clean Water Action Fund in February of 2018 as a program organizer focused on toxic chemicals and emerging contaminants in Minnesota, and was previously field director of Clean Water Action's Baltimore office. During his years with Clean Water, Tom has worked on a variety of successful campaigns, including passage of pesticide and antibiotic legislation in Maryland and efforts to reduce flame retardants, PFAS, and other harmful chemicals in Minnesota. Welcome, Tom.
Thanks very much, Courtney, and I just feel very fortunate to be here today, especially hearing the stories of my fellow panelists and those who came in the previous panel. Yeah, my name's Tom Johnson. Real easy to remember. I'm with Clean Water Action, which is a national organization, but environmental organization. But in the states that we're located, we are very focused on local and state work. And my particular position is as an organizer. So mostly today, I'll be sharing the perspective of organizing on these issues and talking with community members in various different communities that have been exposed here in Minnesota, and just to Minnesotans in general about PFAS contamination, because it's been a real challenge because of some of the gaps we have in data and really just the lack of certainty we have with what constitutes what blood levels constitute a health risk, what health risks are links, or is there any certitude to that? So one big part of my work is a public education, what we would call a healthy home presentation. So that's mostly focused on toxic chemicals in general. We talk to people around the metro and further, a little further out, but that would be, not just PFAS, but again, flame retardants and other stuff. But when we go to, say, the East Metro, everybody wants to hear about PFAS. The East Metro of the Minneapolis-St. Paul area is home to a 150 square mile groundwater plume, the result of about 5 or 6 decades of dumping of chemical waste by 3M Corporation in their production of Scotchgard and firefighting foams and other uses of PFAS. That resulted, as folks may know, in a settlement of $850 million in 2018. However, it's since become clear that what seems to be a large amount of money, $850 million, will barely cover just getting everybody clean, drinking clean, affordable drinking water in their area. There's not going to be any remediation of that plume. So these folks may continue to be exposed in the areas that they recreate, even with all this money that's been there. But that's a little bit beside the point. When we talk to these folks about PFAS, there's a lot of frustration, both on their part and on our part. When I'm talking to them about potential health effects of PFAS, they're understandably asking, well, am I going to get this? Is my kid going to get this? We've been in the region for this long, for 15 years, are we at a greater risk? And honestly, though, that's a hard thing to be able to say. We don't really have the kinds of links from testing to exposures to health outcomes that we need to really get people the information they need. For example, one of the women I've talked to and has since become a good friend, you know, a previous pregnancy of hers was, you know, her baby was at 5 pounds, 10 ounces, and she was hospitalized for high blood pressure during her first pregnancy. Now she's pregnant again and, you know, trying to talk to her doctor about this. And there's really not much that the doctor can say with any certitude that this is PFAS or you know, something else. But there's just so much anecdotal evidence out there over, you know, 50 years, probably 70 years at this point of exposure in this area, that, you know, when you're talking to people in these areas, it becomes pretty clear that there's a link, even if that may not be technically statistically significant or anything. It's pretty clear when you have those conversations. Folks, it's not just people in those areas either. I mean, folks move around, and so if you might spend 5 years in one community, 10 years in another community, and you know, 5 years later you find out that the community you lived in for 10 years had these high levels of PFAS exposure. This happened to one of our staff members' parents was living in Bemidji, and suddenly they find out Bemidji Airport in northern Minnesota is a huge source of is contaminating the municipal well, you know, right near the community where they live. So this isn't just an East Metro problem. It's kind of everywhere. Minnesota has just discovered that out of the 120 or so closed landfills across the state, there's more than half of them are testing for high levels of PFAS, and in some cases though that has leaked or maybe might leak in the future into local drinking water supplies. So while we have biomonitoring, that is a great program for the East Metro here in Minnesota, that's not a program that is available to all Minnesotans who might live in different areas of the state that are also exposed. We have it's been a great tool in the East Metro. We've seen tests in 2008, and then you add bottled water into a community. Okay, well, and then you see 2 years later, those levels have been reduced. And then you add in a drinking water treatment system, and then lo and behold, a year later, those levels have been reduced. So it's a useful tool, but I think the more that we can do this testing, the more that we have those real bona fide links between the blood levels and health outcomes that have currently been linked, but we cannot say to anybody with certainty right now. So I guess in closing, just thanks to the academies for giving voice to this issue. I think it's really important to contextualize like this really gigantic problem by really giving voice to it in the folks that have to live with that contamination every day. And thanks again to all the fellow panelists. So appreciate the time.
Thank you, Tom.